Sphenoid bone is a single unpaired bone located at the base of the skull in the middle of the cranial floor. It is butterfly-shaped and acts like a keystone bone of the cranial skeleton because it articulates with nearly all other cranial bones. Now let's talk about the articulations of sphenoid bone with other bones. The frontal bone, ethmoid bone, occipital bone, to right and left temporal bones, to right and left parietal bones, vomer, this is a sphenoid bone, ethmoid and vomer, to right and left palatine bones, sphenoid bone, and zygomatic bones, aka cheekbones. And right and left maxillary bones, and I will show you later how maxillary bone is connected to sphenoid bone. Now let's discuss sphenoid bone and its parts, and these colored dashed circles highlight openings, foramina, or other possible passages. What I want you to pay attention to are the parts that I select, which show in bright magenta or vivid purple. We have four major parts. The first one we see is the body, which is a central cube-shaped portion, contains the sphenoidal sinuses. Let me show you that sinus. When I cut the sphenoid bone horizontally and remove the top part, you are going to see inside the body there is a air-filled sinus. Those are the openings and those are the sinuses itself. Why do we need the sinuses? Please write down your answers in the comment section. Because the sphenoid bone looks like a butterfly, obviously we distinguish the wings, and we can also see two sets of wings. One we call the lesser wings. This one is the left one, that is a right lesser wing. Here you have the greater wing on the left side and on the right side. As you can see, the lesser wing and the greater wing together, they create a crack. It's a crack because it's not fully formed by these two wings. We call this one superior orbital fissure. We call this one a fissure because fissure means a crack. On both sides, yeah? Lesser wing, greater wing, and the left superior orbital fissure. Because we have the superior in the name, obviously we are going to have the inferior as well. But interestingly, this fissure is created by another bone, not only the sphenoid bone. We need here the maxilla. And I will show you later exactly when the maxilla sits here in front of the sphenoid bone, two bones create inferior orbital fissure. Now let's continue. Lesser ring, greater rings, and the body. The last one I want to talk about is here, pterygoid processes on each side. Now these pterygoid processes, as you can see, they are divided like fingers are divided, right? The forks. Everything that is divided in a bone, that is an increased surface area for many reasons. In this case, that's a muscle attachment for medial pterygoid or lateral pterygoid and superior pharyngeal constrictor muscles, and as well as the attachment sites for the pterygospinous ligament and pterygomandibular ray. As you can see, the greater ring on both sides have this small opening. We call this one foramen rotundum. That's a very important foramen from here to there on both sides. Foramen rotundum allows for the passage of the maxillary nerve. Additionally, we have here sphenopalatine foramen, which is created by the palatine bone as well, but we'll show you that later. And a pterygoid canal, that is a canal because it's quite long. It starts or it ends from here on the greater sphenoid wing. The function on both sides for the pterygoid canal allows for the passage of the artery, vein, and the nerve of the pterygoid canal. We should not forget this, which is optic canal. Here we have the body and the lesser ring, body and the lesser ring, and between the junction there is optic canal from where optic nerve enters the skull. And lastly, in terms of the sphenoid bone parts, I want to tilt this way and show you here we have other two openings. And in order for you to see the 3D dimension, you are going to observe different angles. Now, this is a foramen, and we call this foramen lacerum on both sides. This foramen lacerum is created not only by the sphenoid but also occipital bone as well as the temporal bone, and through which meningeal arterial branches, emissary veins, and the deep petrosal nerve exit and enter. Now, let's talk about the surfaces. The body of the sphenoid bone has anterior surface. The body also has this depression we call sella turcica. And on the body, there is also posterior surface of the body of sphenoid bone, which is connected to occipital bone. In terms of the lesser wings, anteriorly, we can distinguish anterior margin of lesser ring. Each anterior border articulates with the sphenoid margin of the frontal bone, contributing to the formation of sphenofrontal suture on both sides. Posteriorly, we can distinguish posterior margin of lesser ring on both sides. They provide attachment sites for the tentorium cerebelli, and diaphragma sella contributes to the formation of the boundary that separate the anterior and middle cranial fossa. On the lesser ring or the junction of the lesser ring, we can distinguish sphenoidal yoke. There are superior surface of the lesser ring, and obviously there will be inferior surface of lesser ring. Now let's move to the greater rings. The greater ring, anteriorly we can distinguish the orbital surface of greater ring, which creates orbit or contributes to the formation of the lateral wall of an orbit. When we turn around laterally, we can distinguish temporal surface of greater ring where the temporalis muscle is attached, or you can also say originates. Here you can distinguish three sutures with other neurocranial bones. The one is here frontal margin of greater ring through which the frontal bone is attached, parietal margin of greater wing through which the parietal bone is attached, and squamosal margin of greater wing through which the squamous part of temporal bone is attached. Here you have infratemporal crest and infratemporal surface of the greater wing, which provide an origin site for a superior head of lateral pterygoid muscles. Now let's turn posteriorly, and we can distinguish cerebral surface of greater wing contributes to the formation of the middle cranial fossa, anterior cranial fossa, middle cranial fossa. Now turn around this again, and let's look at the pterygoid processes, which is divided into two parts, the lateral and the medial parts. Logically, these two parts are called medial pterygoid plate and lateral pterygoid plate on the right side and on the left side, which is identical. Now let's talk about the landmarks. Now, for example, Let's begin anteriorly and see that this is called ethmoidal spine of the sphenoid bone. We call this ethmoidal because anterior to that, ethmoid bone is attached. Lower to that, the inferiorly, we can distinguish the sphenoidal crest, and it articulates with the perpendicular plate of the ethmoid bone, contributing to the formation of the sphenoethmoidal suture. Inferior to that, we can distinguish sphenoidal rostrum. Rostrum means nose, which articulates with the superior border of vomer, contributing to the formation of the sphenovomerine suture. Lateral to each side of sphenoidal crest, we have sphenoidal concha. Each sphenoidal concha is located lateral to the sphenoidal crest and contributes to the formation of the anterior wall of sphenoidal sinus. Let's turn laterally and we can distinguish temporal fossa. Posteriorly, we can distinguish beautiful structures here, especially on the body and on the sella thoracica. First of all, we can distinguish here the spikes, which is called anterior clinoid process on the lesser wings. Because we have anterior, obviously we are going to have posterior, and here you have the posterior clinoid processes. Now, what is the function of that? Its corresponding side, each anterior clinoid process provides attachment sites for the tentorium cerebelli and diaphragma sella. Here you have the chiasmatic sulcus, because we know that when the optic nerve enters through the optic canal, these optic nerves merge and they create chiasm, which is a crossed structure. After that, there is tuberculum sella, and here it is dorsum sella, and the concave landmark is hypophyseal fossa. It lodges the pituitary gland. This one is clivus, and the clivus accommodates the brainstem. Beautiful, isn't it? Now let's turn around and observe these landmarks here, which is pterygoid humulus, provides an origin site for a superior pharyngeal constrictor muscle and an attachment sites for a pterygomandibular raphe. Now let's talk about the sutures that the sphenoid bone creates. Sphenofrontal suture, sphenoethmoidal suture, sphenoparietal suture on both sides, sphenotemporal suture, sphenoid bone, temporal bone, sphenovomerine suture, sphenoid bone, vomer, ethmoid bone, vomer, sphenopalatine suture. Here is sphenoid bone and the two palatine bones. I want you to remember that palatine bones, especially these horizontal parts of the palatine bones, create the posterior part of hard palate. Now I want to show you what creates anterior part of the hard palate. Sphenoid bone creates a suture we call pterygopalato-maxillary suture, through which a maxilla can be attached, or creating the suture with the sphenoid bone. Additionally to that, I want to tilt and let's observe this diagram inferiorly, and we're going to observe these two palatine bones with the horizontal plates, and anterior to that we have maxilla, and maxilla also creates the hard palate, but the maxilla creates the anterior part. However, palatine bones create posterior part of the hard palate. And we should not forget sphenomaxillary suture, which is created there on the greater wing of sphenoid bone. Now let's talk about the arterial supply of this sphenoid bone. There are some branches that are coming from the internal carotid artery, and there are some that come from the external carotid artery, and I want to show you all of those. Let's start with this tiny section of the artery, which we call sphenopalatine artery. We call that as a name because through this, it is going to supply sphenoid as well as palatine structures, or the nasal cavity as well as the palatine structures. Now, interestingly, this sphenopalatine artery, which is present on both sides, they originate from the artery called with maxillary artery. Actually, the maxillary artery originates from external carotid artery, which originates from, or it's a branch of, left common carotid artery in this case. But if we talk about the right maxillary artery, we can talk about the right external carotid artery as well as the right common carotid artery and brachiocephalic trunk. Brachio means arm, cephalic means head. So through this trunk, the arteries are going to divide towards the head, cephalic, or towards the arm, brachial. Alrighty. So that was one of the branches that we called, again, let me remind you, sphenopalatine artery. Additionally, I want to distinguish these two arteries, or the parts of the arteries we call posterior ethmoidal artery, which obviously is going to have some branches towards the ethmoid, right? Both of them on the right side, on the left side, they enter the ethmoidal bone. Again, these are called posterior ethmoidal artery. Now let's talk about from where these posterior ethmoidal arteries originate from. This one is left posterior ethmoidal artery. This is ophthalmic artery, and we know this artery from the previous video, which originates from internal carotid artery, which is the branch of left common carotid artery in this case, or we can also have the right common and the brachiocephalic trunk, and this is just directly coming from the aortic arch. So here you have, as I said, sphenoid bone receives the blood supply, oxygenated blood, from both external and internal carotid arteries. Sphenopalatine artery, which is a branch of maxillary artery, which is a branch of external carotid artery, which is a branch of common carotid artery on both sides, right and left. Let me show you the origin for that one, and I think we are good. Well, actually, thanks for watching. We are done, and in the next video, we are going to talk about the ethmoid bone with the parts, landmarks, surfaces, arterial supply. Thank you so much, and I'll see you in the next one.